Good morning, happy Groundhog Day, and welcome to the February monthly member briefing. I'm Thomas Deere. I'm the Vice President of Sales Engagement at the Chamber, and I have the privilege of being your host. And I want to shout out a big thank you to each of you for joining us today, and thank you for your partnership at the Chamber. Without you, nothing we can do would be possible. These sessions are designed to provide you with information, solutions, and connections needed to keep your businesses thriving. Today, you have joined in listen-only mode with your microphones and cameras muted. We do encourage you to ask questions throughout the program using Zoom's chat box. Going through the presentation, talking to the speakers before we start today, I believe you're going to have a lot of questions, a lot of great information. We have an incredible lineup today, and I know you're going to enjoy it. It's my pleasure to welcome Brendan Call, the President of the Cincinnati, USA Regional Chamber. Brendan, take it away.
Thanks, Thomas. You know, on Groundhog Day, you're supposed to start the morning with "Okay, campers, rise and shine." Hope you all have your annual screening of the great movie Groundhog Day. But I'm excited to welcome you here to this month's monthly member briefing. I read on the news this morning that we've got 6 more weeks of winter in store for us. So I know you were all waiting for that important alert here on the monthly member briefing. There's a few things that are on my radar this morning that I want to be on your radar. First of all, I can't help but say it because we're still, recovering from this weekend, but what a tremendous Bengals season. It was really awesome. That team is a Super Bowl team. And, on behalf of the Chamber official position here, some of those referee calls were absolutely terrible and we should have been in the Super Bowl. But hooday, and we will be back. It was a great season. And so to everybody who had enjoyed that, the economic value of that, thank you. Around here, we're really excited about what's up ahead. We're launching, coming up, our Hello Cincy Executive Program. This is really going to be tremendous. It's for new C-suite executives who move into the region from elsewhere. We hear oftentimes about how new C-suite executives move here and want to get linked up with others in their cohort. So we're putting together a very small program where they'll be able to interact with each other, get connected into the community, and really understand how Cincinnati works. That's important to us. We're not like other cities. No city is like another city. And so making sure that you get connected into Cincinnati matters a lot. We had an absolutely fantastic board meeting earlier this week where we reviewed our accomplishments and our plan for the coming year. We're excited about that and look forward to continuing to tell you about that. We're getting ready for our annual dinner, which is 1 month from today on March the 2nd at the Duke Energy Convention Center. This is our Great Living Cincinnatian dinner. It's really fantastic. We honor 4 Great Living Cincinnatians. This year, we'll be honoring Janet Reed, Larry Shakely, C. Smith, and Don Kleekamp. Absolutely tremendous leaders with phenomenal stories of leadership in our community. It's really wonderful to be able to honor them. Point of personal privilege, my first boss out of college at Xavier University was Janet Reed. Spent some time working at Global Lead Management Consulting for her. And she is truly one of the most special, wonderful leaders in our community who has done so much for our city and for business here. And so I'm excited to honor her. You want to be at this event. The other thing that we do at this event that I love is we celebrate making Black history. This is a program that Danielle Wilson, who is our Vice President of Marketing and Communications, started about 5 years ago. We honor several African-American leaders from our region to talk about how they're making Black history today. Those honorees, I'm really excited to tell you about. We put it out yesterday. Christy Coons from the Urban League, Marcus Thompson, now from Triversity, Vice Mayor Jan Michelle Lemon-Kearney, Claudia Abercrombie, Derek Brazil, who helped founded Mortar and runs Pata Roja Tacos now, Liza Smitherman, and Rosemary Oglesby Henry, who runs Rosemary's Babies. This is an absolutely phenomenal group. They'll all be there at the annual dinner as well. So I just want to make sure that that's on your radar and your calendar. And then finally, I want to note, we had a great leadership alumni kickoff this week. Andrea Mersman from our team leads our leadership alumni programs. If you've been through one of our leadership programs, Leadership Cincinnati, We Lead, See Change, you know how great they are. They had an awesome event at the Sign Museum. If you're not coming to those events and you are a leadership alumni, go to our website, sign up for it. It's great stuff that's going there. Helps you get connected and help build community in our city and help get you connected to everything that's going on. Okay, Now, I'm really excited to introduce 3 leaders from TriHealth. I think they did that on purpose. They go everywhere in threes since it's TriHealth. But I'm really excited about this because I'm going to first introduce you to Mark Clement, who's our main speaker, the president and CEO of TriHealth, and his 2 partners today. And I'll introduce them at the end, and then he can tell you a little bit more about them as well, too. But what I want you to know about Mark is that he is one of the most committed CEOs in our region. If you take a look at the body of community leadership that Mark and his team and organization has done, it's absolutely incredible. This is a $2.1 billion health system, the 4th largest employer in the region, if I've got the stats correct from the most recent forms that I saw. It's an award-winning health system, frequently recognized by all of the national institutions that you would expect them to be recognized, including U.S. News and World Report and Newsweek, the American Heart Association, and many more. You see them everywhere, no matter where you go. Maybe you were born in one of the hospitals, maybe you were there because you needed something done from an emergency perspective. You know their doctors, you know their nurses, and you know their team everywhere. But you also see them out and about. I saw them at the ArtsWave campaign. Mark helped sponsor the Highway to Health band at the ArtsWave team, which I think, did you win? I can't remember.
We did indeed.
You won. There were so many people at the ArtsWave celebration at Hard Rock last year. It was incredible. The TriHealth team, they do work with the Western and Southern Open. And then we were talking before we started, an incredible partnership with my alma mater and Mark's alma mater, Xavier University. Here's what I love. The last thing I'll say, most of Mark's career has been out of Cincinnati. Xavier has a really tremendous master's in health administration program, friends who have been through that program. And oftentimes they'll go away and go run hospitals or go run medical facilities elsewhere. Mark came back in late 2015, early 2016 to run TriHealth. And it's really cool because he's home in the community in which he grew up, leading such an incredible institution. I'm so glad today that he's here and that he's joined by 2 colleagues, Dr. Stephen Cleves, who is the System Chief for Primary Care, and Terri Hanlon-Bremer, the EVP and COO of TriHealth. And I'm going to let Mark tell you more about them, but let me turn it over to Mark. Thank you guys so much for being here today.
Well, terrific, Brandon, and thank you for that very kind and generous, introduction, both for me personally as well as my team, our team, and TriHealth. Thank you, Thomas, as well for helping to organize this opportunity that you've extended to us. We're excited to be able to join you today. So thank you, both Brandon and Thomas. Brandon is right. I'm a native of Cincinnati. I grew up in Cincinnati. Don't hold it against me, but I went to Muller High School, then on to Xavier University for an undergraduate and graduate degree, and then spent most of my career working in Chicago, Boston, and New York before being extended really the privilege of my life to return to my hometown. Like the other 2 members that are going to be participating in this conversation, Terri Hanlon-Bremer, our Chief Operating Officer, who will introduce herself in just a moment, and Dr. Steve Cleves, our Chief of Primary Care, and my personal primary care doctor. We all have very deep and strong connections to both Cincinnati and to TriHealth. I was born at one of TriHealth's hospitals. My dad did his residency as a physician at one of our hospitals, went on to practice at another. One of my brothers is a primary care doctor. So it's been a real privilege to return to Cincinnati. Dr. Cleves trained at one of our hospitals, did his residency. His son is a resident at one of our hospitals. Terri Hanlon-Bremer started her career as one of our floor nurses at one of our hospitals. So we have deep personal connections. For us, the work that we do is really more of a calling than a job. So thank you again for the opportunity to be with you this morning. Brandon, talked briefly about TriHealth. TriHealth, I think, is the 3rd largest employer in the community. We employ about 13,000 team members and physicians. We are a proud member of the chamber. One of our executives participates in the chamber board, and we care for about between 500,000 and 600,000 members of our community regularly in our primary care network and in our integrated delivery system. We are the largest integrated delivery system in Cincinnati and in the region. I'll talk about why that's important in just a moment. We operate 5 hospitals, 2 nationally recognized, what we call tertiary hospitals, which are really the those hospitals, large hospitals, academic teaching hospitals that care for the sickest of the sick, provide the most complex care. And Brandon, you're right. We've been recognized and are regularly recognized as meaning our 2 flagship hospitals, Bethesda North and Good Samaritan Hospital, as being among the best hospitals in the nation. Just a few weeks ago, Bethesda North was recognized by Health Grades, which takes publicly reported quality and clinical and patient experience data and puts it in their black box and rates and ranks hospitals. We were ranked as among the top best 1% of hospitals in the country, the top 50 hospitals in the country, those recognitions extend to Good Samaritan Hospital as well. But as the 3rd largest employer in Greater Cincinnati, we experience many of the same challenges that other employers experience with rising costs of healthcare, with the challenges of our nation's healthcare industry. And we're going to talk a little bit about how we've addressed those challenges in the course of our conversation today, and how we're assisting thousands of employers in this community through our corporate health and employer solutions division, which is the largest such provider of corporate health services in the Midwest. It's about a $50 to $60 million line of business within our system. We're going to talk a little bit about how we're helping employers to deal with those real problems of rising healthcare costs, of fragmentation in our healthcare industry and the like. But unlike many other health systems in this country, we recognize that our healthcare industry is broken. And we have been on a journey for the past more than 10 years to fix our broken health system. Our call to action is to get healthcare right. And let me first talk a little bit about some of the structural problems that exist in our nation's healthcare industry. As a nation, we spend more on healthcare than any other nation in the world, and we get less than most. We do lead the world at approaching 20% of our gross domestic product being devoted to healthcare spending, but we rank somewhere between 35 and 40 in the nation, in the world, when compared with other Western nations, based upon life expectancy, infant mortality, access to healthcare. So we spend more, get less. We really have more. We have more of a sick care system in our country than we have a healthcare system in our country. Those of you that have accessed healthcare, the healthcare services, if you've had a loved one that's had an illness or an injury, and you've had to navigate our system, that it's fragmented. It's often reactive. Care is not well coordinated, and our cost trends are unsustainable. What many of you may not know, and as I was talking to Jill Meyer a few months ago, I think she was a little surprised to hear, is that we have a perverse set of economic incentives that I think are really causing our industry to operate the way it operates, and that's what we call a fee-for-service payment system. Edward Deming once said, every system is perfectly designed to deliver the results it delivers. Well, healthcare, because of our fee-for-service financing system, delivers outcomes that are pretty fragmented, episodic, not well coordinated, sick focused rather than health focused, because we get paid only when patients are sick or need healthcare services. We don't get paid if they're healthy and well. And if we worked really, really hard to keep people healthy and well, we wouldn't generate fees and we'd go out of business. Those are the perverse incentives. And we generate more fees and generate more revenue if we provide more volume of care. Therein lies a big part of what's broken in our healthcare system. We've got incentives that encourage the kind of behavior that we see in our system. But not all health systems are alike. You can look across the country, you can look across the region and at various health systems, and you can say they all do the same thing. I would argue that the TriHealth is unique because we have recognized these really fundamental structural problems in our industry, and we went to work 10 years ago to fix those challenges. Maybe we could go to the next slide. And so our vision, the vision that's really, unlike many organizations, they have a lofty vision that's posted to the on their walls in their board meeting, but they don't do anything about them. Our vision has really guided our organization. We are on a journey to fix healthcare and to really embrace innovative care and financing models that are really aligned around what we call the triple aim plus one. The triple aim plus one is better care, meaning the experience of care that patients have when they use our healthcare industry. Better health, objectively, measurably better health, improving the health of the community that we serve, not just simply waiting for people to get sick or be injured and reactively come to our system to receive an episode of care, but proactively working to improve the health of our community, the more than 500,000 members of our community we care for. The third dimension of the triple aim is delivering more affordable care, more cost effectively. And the plus one really relates to building a culture and an integrated delivery system that is an enhanced practice and work environment for our team members. We believe that culture is everything, and we've invested significantly in building a high-performing culture that supports our team members and our physicians in doing their best and being their best as we work to get healthcare right by delivering on that triple aim of better care, better health, and better value. Maybe we can go to the next slide. And this is a little bit of a complicated slide, and I'll explain it in just a moment. But what I'm going to do in the course of my comments is try to frame this conversation, give you a sense of the work that's underway throughout TriHealth, our large integrated system. And then I'm going to ask Dr. Cleves who leads our primary care network, the largest primary care network of physicians and advanced practice providers in the region, about 300 primary care providers, both pediatricians as well as adult primary care physicians. I'm going to give Dr. Cleves an opportunity to talk a little bit about the care models that we've put in place that really do proactively improve the health of the community that we serve, and to do that through using big data to really understand the health of those nearly 600,000 members of the community we care for, so we can close gaps in care, so we can manage rising risk, so we can better manage chronic conditions. And we do that not just when those patients are in a physician's office, or when they're in one of our 6 emergency departments, or when they're in one of our 5 hospitals, or when they're in one of our 13 or 14 major ambulatory campuses. We do it as patients are living their lives in their homes by reaching out through our care coordination team, more than 50 ambulatory care managers who are working with those patients that need intervention, again, to close gaps in care, or to manage chronic conditions, or to deal with rising risk, or whatever other health need they have. And the insights that come from the investments that we've made in big data, digitizing medical record patient information, allows us to really understand stratify and then understand which of our patients require active intervention through our various effector arms, care management, our proactive reimagined primary care practices, and the like. Maybe we can go back one more slide. I want to kind of explain this. So when we think about getting healthcare right, is really all about objectively measurably delivering on better care, better experience of care, better health, overall health of the patients we care for, in more cost-effective, affordable care. And we do that by bringing together our high-value network of hospitals ambulatory sites and service lines, coupled with our world-class physician community, both employed and affiliated. Virtually all of the premier independent specialty groups in this market are deeply affiliated and partner with TriHealth. That ranges from Mayfield Spine and Neurosurgery Group to Beacon Orthopedics to the Urology Group to Cincinnati Eye Institute. They are all partners with TriHealth in our integrated delivery system. And then we bring, again, our high value network of hospitals, ambulatory sites, service lines together with our world-class physician community, both employed and independent. We employ about 700 physicians, 300 of whom are primary care physicians. The balance are specialists. And then we apply our what we call our population health or value-based care operating model, which is innovative financing systems that we've forged with collaborative payers ranging from government for Medicare and Medicaid to commercial payers like Humana that's sponsoring this event this morning, Anthem, United Healthcare, to really evolve payment models to reward us for keeping patients healthy, for providing care in the most cost-effective way, which is increasingly not in hospitals. It's increasingly in the ambulatory or outpatient setting, and increasingly in the home. Where in a traditional fee-for-service payment system, we would get paid nothing or much less than we would get paid in the inpatient setting, where we generate the highest revenue per episode of care and the highest margins. So we've needed to change those perverse incentives to reward our health system and to reward our providers, physicians, both primary care and specialists, for keeping our patients healthy, avoiding unnecessary episodes of care, providing care in the most cost-effective setting, which again increasingly is in the outpatient setting. And we call those payment arrangements value-based payment arrangements, where we share in savings against a total cost of care budget. In some cases, we take full risk for a patient population, meaning we provide all of the care that a patient population requires for a defined per member per month amount, no longer fee for service. Again, realigning those payment models and incentives to reward us for improving health, in delivering a better patient experience, and delivering more cost-effective care. Maybe we can go to the next slide. So today, and I noted a moment ago, TriHealth operates the largest primary care network, which is really critical to getting healthcare right. We've reinvented how we deliver primary care services, our offices and our physicians. We've evolved compensation models for our physicians to reward our physicians for keeping patients healthy and delivering care in the most cost-effective site. We have the largest network of ambulatory campuses. You see them, Brandon, you noted this as you made the introduction. TriHealth is ubiquitous. That's not an accident. We have very deliberately constructed major ambulatory campuses or outpatient campuses that really represent kind of one-stop shopping for healthcare on an outpatient basis. Primary care, specialty physicians, oftentimes urgent care, ancillary services like radiology, laboratory, and others. Today we have 13 of those major ambulatory campuses, more than any other health system in Cincinnati, and more than most health systems in the country, because we, like Wayne Gretzky once said, he skates to where the puck is going to be, not where the puck is. We are skating to where the puck is going to be. And it is less in the future. More care is going to be provided outside of inpatient settings in the ambulatory setting than in our inpatient hospitals. So we have built the infrastructure to prepare for that. And today, more than 95% of all the care that we provide is delivered in the outpatient setting. not in hospital beds, not in critical care units, but in the outpatient setting. And about 75% of all of our revenue comes from care provided in the outpatient setting, far more than any other health system in Cincinnati. And that's one of the reasons and one of the ways that we've been able to dramatically bend the cost curve. Terri Hanlon is going to talk a little bit about our performance, but I'll just note that we have been recognized by the major national payers, Anthem, United, as being the among the top performing accountable care organizations in the country. We measurably deliver care more cost effectively, between 10 and 15% below the community overall open network costs. And our patients are objectively measurably healthier. Their chronic conditions are better managed. Gaps in care, meaning preventative measures and health screenings, are done at a much higher percentage than the average in our industry. Rising risk is being better managed. Immunizations are being delivered at a higher percentage, et cetera, et cetera. So this work that's been underway at TriHealth for 10 years is really paying dividends, and many of our employer partners are benefiting from that through some of the employer solutions that we will talk about in just a moment. We put our money where our mouth is. We're not just talking about getting healthcare right. We've invested and continue to invest every year more than $25 million in supporting the infrastructure, whether that's ambulatory care managers who are proactively reaching out to patients who need intervention, or the big data and analytics that we've built to create the insights around where we should be reaching out, to reinventing our primary care practices. Again, no other health system in this market, or even most in the country, are doing that, and it's paying big dividends in terms of improved health of our 500,000+ members of the community we care for, as well as more cost-effective and affordable care. I'm going to pause here and now give Dr. Cleves an opportunity to talk about how we do that at the front line of our organization, where we're actually touching and caring for patients.
Thanks, Mark. Good morning, everyone. I'm Steve Cleves. I'm a primary care internist. I have been in Cincinnati my entire life. I've been in practice for 32 years. And the journey that Mark explained that TriHealth is going through really mimics what a lot of us old-time primary care doctors have been through. Excuse me. When I graduated from my residency, I actually hung out a shingle. I had 2 exam tables. I had 4 chairs in a waiting room. I had a receptionist and a medical assistant. And that's how I delivered care. Very episodic. Someone would come in, I'd give them my advice, I'd write a prescription, they'd leave. I have no clue whether they followed up on my advice. I had no clue whether they filled their prescription. I had no inkling whether they'd even come back again. So take that very personal, very Marcus Welby-ish experience and fast forward to where we are now. After 5 years in solo practice, I joined a group called Queen City Physicians, a large primary care group. And 8 years ago, I joined TriHealth. Excuse me. So what we do now, compared to what I did when I started, is what I call a team sport. We are very much a team sport. My team has expanded dramatically. Now, when I see the patient, I know if they went and filled their prescription because we get data from the pharmacy about refill rates and about medication adherence. I have outreach to say, did you remember to go get your mammogram? Did you remember to schedule your colonoscopy? I have an entire team of people who help me to do what I do better. I think I probably still do a lot of the same stuff in the exam room, but this team around me, which includes nurses, it includes pharmacists to make sure we get the patient on the right drug that's covered best by their managed care plan, social workers to help them with transportation and food inequity, care coordinators to make sure they get their specialty appointment with the oncologist or with the cardiologist. Even something as simple, excuse me again, as a more robust phone system where I can easily connect them to an office down the street where their specialist is, or schedule them with their next appointment. And then beyond that, we have very specific disease management capabilities, especially around diabetes. Diabetes that used to be, here's a diet, try to follow it. Now it's medication adherence. It's a meeting with a dietitian, which TriHealth funds, no charge to the patient. It's a meeting with a diabetic nurse specialist. Again, no charge. TriHealth funds that, so that we know by providing this team approach, the patients get better care, their blood sugars are better controlled, there's less complications down the road in their diabetes, which actually means less cost to the system, less cost to the community, less cost to the employer, because the real expensive complication in diabetes isn't the medication. Some of them are expensive, yes, but it's the kidney transplant, it's the dialysis, it's the loss of life and limb because of the vascular complications of diabetes. So by providing this team around the primary care physician, TriHealth has really given us all the tools that we need to really enhance the care that happens in the community. It is a much more robust system. And if you go maybe up one more slide, you can see what the team has accomplished. We have truly broadened our access. As Mark says, we have almost 300 primary care docs. We're open evenings, we're open Saturdays. We have a relationship with Walgreens clinics. So my patients can go to Walgreens. Walgreens clinic is on the same computer system, so they can see what I did, I can see what Walgreens does. TriHealth has urgent cares across the city. So we've really improved our access, and we have better outcomes. We're showing a dramatic reduction in lung cancer. We're showing a dramatic reduction in diabetes complications. We're knocking it out of the park in terms of breast cancer screening. And that's not because I'm any better than I was 32 years ago. It's because I have this entire network that supports everything that I do. It's really kind of cool to be able to look back and see, where this journey has brought me personally and the care that it's brought my patients collectively. As Mark said a moment ago, I have a son who is an internal medicine resident at Good Samaritan Hospital. And although I try not to pressure him too hard, he knows my love for primary care, and he knows I believe it's the greatest job in the world. What I tell folks is I have the ability to meet all kinds of people all day long, spend a lot of time getting into their lives, helping them manage their problems. My tagline, if you will, is I laugh with my patients, I cry with my patients, and unfortunately, sometimes more often than I like to admit, I go to patients' funerals. I'm with them all along that journey. And I love the fact that TriHealth supports me and allows me to do those things without having to worry about some of the business sides, some of the financial sides that can be really daunting from a primary care physician's perspective. We are not just paid in the perverse incentives anymore. I'm paid to improve diabetes. I'm paid to keep them out of the emergency room. I'm paid to answer, their questions after hours so that they can come see me the next day instead of going, to the hospital for expensive care. So I could not do nearly as good of a job day to day caring for everyone if I didn't have the TriHealth system behind me. It's really been an incredible journey. It's been a great experience.
Dr. Carter or Dr. Cleves, thank you so much. I saw Carter on it. Dr. Cleves, thank you so much. I just want to let you know we have about 2 minutes left in the time, so we make sure we get to others. So I want to, if Terri has some,
we got to get to Terri. Absolutely.
I want to make sure she has a couple of minutes, and then we'll have to wrap and move on to the next speaker.
Thank you, Brendan. I'll jump in real quickly. Good morning, everyone. I'm Terri Hanlon-Bremer, native Cincinnatian, nurse by training, still with an active license, and been at TriHealth 16 years. Let me just connect a couple dots quickly. First of all, our mission is to improve the health status of the people we serve. And I think what we're depicting today is that we are doing that in a different manner. When you look at this slide, this is really the clinically integrated network that Mark referenced, and there's one word to it: collaboration. one, collaboration with partners in the community. This is around what TriHealth can do, but do it in conjunction with others in the market. And why is that important? It's important because we have a high-performing network that we can have both at a choice level through tiering or in something that's a little more narrow. Either way, we're going to achieve the outcomes that Dr. Cleves referenced because we're managing populations in a much more effective manner to drive clinical outcomes and reduce cost. And that is important because we are a large employer. And if we as employers all have healthier employees, that will ripple out to family members and that will ripple out to the community, and our community will be better. If you'll go to the next slide, Brendan or Thomas, thank you. You know, corporate health is a big component of this journey. While Dr. Cleves did a great job of outlining what we're doing in the physician side of things, that is both at prevention and at acute care. Corporate health has been around for 40 years, and it really is looking at how do we really move upstream from a prevention perspective, understand what that employer's needs are, and how to keep your employees healthy, productive, and back to work in a really strong manner. So you can see here a variety of services that we have had employed in this community for decades. But the real takeaway message is all of this is integrated together. So there is a continuum of care across the system, all the way from the very beginning of prevention through end of life care and all in between. And what I'll maybe leave with and then turn it over to Mark to close out is what I'm really proud of being a member of what the work is here is that it's different. It is not traditional healthcare. We are disrupting. We are changing how things are provided. We're doing different care models. Our doctors are compensated based on outcomes, not on fee for service in the primary care world. And we are continuing to push this envelope. And I think as an employer, we're practicing also on ourselves. We can take it out and share it to the community. Mark, I'll give it back to you.
Yeah. So, well, thank you, Terry. Thank you, Dr. Cleves. Brendan, I'm sorry we've gone a little late, but let me just close by saying, you know, it's kind of a dumb expression, you know, we eat our own cooking. So we started this journey more than 10 years ago when we were challenged by double-digit year-over-year medical cost increase for our 13,000 team members, and we created this high-performing network. We changed the economic incentives, and what I will tell you is we've been able to cut the year-over-year rate of increase in our own medical spend to a fraction of what it was traditionally, and at the same time improve the overall health and wellness of our own team members. We're now offering those same services to employers, and we would love to talk to any of the members of the chamber about how we can help you to deal with some of the real challenges that you're facing in terms of year-over-year cost increases with your own employee health programs, as well as presenteeism and the health and well-being of your workforce. We have solutions for you that can make a big difference. And all you need to do is reach out to the TriHealth Corporate Health Division or myself. You know, Brendan, maybe you can make my contact information available, or Terry's, and we will follow up.
Fantastic.
Thank
Mark?
you all so much. I'm going to turn it back to Thomas, Mark, Terry, Dr. Cleves. Thank you all so much for being here this morning. It's a fascinating look at TriHealth, and thank you for everything that you do. Anybody who's on the call who wants to connect more with TriHealth, we're happy to help facilitate that. And thanks again. Go X.
Great. Go TriHealth.
Mark, Dr. Cleves, and Terry, thank you for sharing how TriHealth is making a difference in the region. Very impressive. Thank you.
Thank you, guys.
Thank you.
It's my pleasure to introduce a chamber member who's been making an impact in the community. Terri York, the Director of Strategic Initiatives of Luma Financial Technology, is going to be telling us about the great things happening at Luma. Terri is responsible for leading corporate development projects and overseeing enterprise partnerships. She holds the Chartered Financial Analyst designation, is an active board member on the CFA Society of Cincinnati, and is the founder and chair of the Society's Women in Investment Management Committee. Luma Financial Technology provides leading independent multi-issuer platform for structured products and annuities. Luma is an award-winning platform that has been used by broker dealers and their advisors nationwide to more efficiently source, configure, compare, and price structured products and annuities to meet their customers' needs. Tara, welcome and tell us all about the superior technology that has earned Luma global recognition.
Thank you for the introduction, Thomas. Good morning, everyone. I appreciate the opportunity today to share a little bit about Luma. Many of you on the call may have never heard of Luma, but I'm sure you've heard the buzzword fintech. Well, we are a fintech company founded and headquartered here in Cincinnati. There are many fintech companies that you as consumers might use every day, like Robinhood, PayPal, Venmo. Well, we are a financial platform for financial professionals, not necessarily end consumers like yourselves. And we provide access to alternative investment solutions to financial professionals around the world. Our platform gives access to alternative investment solutions that historically have been extremely hard to access, very difficult to transact in, and therefore limiting investment opportunities to end investors like yourselves. One clear advantage of Luma is that we offer an end-to-end portfolio management solution. So everything from training and education to order entry, and then a post-sale lifecycle management tool. Next slide, please. So as I mentioned, we are a global firm. We recently had the honors of hosting Monty from the Chamber, as well as the Vice Mayor, to our new expanded office space on the 25th floor of the US Bank Tower on Fountain Square. And this is the headquarters of Luma. We've been in the US Bank Tower for over 10 years now. We also have offices in New York City, Zurich, and then most recently established an office in Miami, Florida to better serve our Latin American expansion. Next slide, please. A little bit about our history. So Tim Bonacy, the CEO of Luma, founded Navient Capital, which is a broker-dealer of Luma Financial Technologies, in 2005. And then little over 10 years, spun out the financial technology out of Navient Capital, which is now Luma Financial Technologies. Since then, we've expanded into both the Latin American and the European markets. And we've also expanded our investment set, not just for structured products, but also for annuities, and then also looking to expand in other areas of the investment solution universe. More recently, we've partnered with some of the largest global institutions around the world to then find other ways in which we can offer transparency and access to these, what have historically been very complex and hard to access type investment solutions. Madison, next slide, please. So again, we serve financial professionals and institutions around the globe, from your individual financial advisor to registered investment advisors, as well as some of the largest public and private banks. Next slide, please. In closing, Luma began over 10 years ago with the mission to illuminate the complex investments, and we continue to be the unquestioned global leader in financial technology that supports alternative investment solutions for financial professionals. I appreciate your guys' time today, and I can answer any questions that may have popped up, Thomas.
Okay. Tara, I have a question. You talked a little bit about the end-to-end portfolio management, and that, explain a little bit more. Is that taking the person from point A all the way through point Z with no handoff? Tell me a little bit more about that.
Yeah, so as an individual financial advisor, the way that you would use our platform is one, starting out with education and training. As I mentioned, some of these investments can be very complex. Also, from a compliance perspective, some of the institutions that these financial professionals work for require compliance and also suitability requirements in order for financial advisors to transact in some of these products. So through the Luma platform, you can, it provides training, education, Also, our product marketplace is another unparalleled advantage that we have in the marketplace today, offering a wide variety of various types of structured products and annuity type products, allowing financial advisors to compare these to then find the best solution for their client to ultimately end up hopefully achieving your end investment goals and objectives. And then post-sale, we have tools available for financial professionals to continue to monitor and manage these investments, ultimately, hopefully leading to better outcomes for end investors.
Fantastic. Thank you so much. That cleared up. That was awesome. Tara, thank you so much. If anybody's interested in finding out more about Luma, please, you can put something in the chat. You can reach out to me at tdeer@cincinnati-chamber.com, and I'll make sure that I get that information to Tara. Tara, thank you so much for your time today. Well done.
Thanks, everyone.
I want to thank Tara and Luma Financial for being part of our monthly member briefing. If you're interested in being part of our monthly member briefing, please reach out to me, tdeer@cincinnati-chamber.com. Switching gears, the Cincinnati Chamber is a total of 9 benefit partners that will enhance your business on an everyday basis. For our partner today, we're so excited to have Monica Colbert back from Humana. She's the consumer engagement professional with Humana, who is our health insurance partner. Humana is a strong legacy partner, and they provide competitive medical, dental, vision, life, and wellness products to our members through Chamber Health. In fact, Monica's here today doing biometric screening for the people at 3 East 4th Street. Members located in Ohio can save up to 20% on their health insurance with Chamber Health and Humana's Go 365 Health and Wellness Program. Monica, tell us more about Go 365 and Chamber Health.
Thank you, Thomas. And I am coming to you from the Chamber of Commerce, which is beautiful if you haven't been to the location. So it's the beginning of February. How are your New Year's resolutions going? We're going to take a few minutes to talk about goal setting, no matter what time of year it is, and how the Chamber Health Plan with Humana can help you stay motivated and achieve them. So to increase the odds of achieving your goals, I recommend using this SMART strategy. It takes your general idea, for example, get healthier or get a promotion, and it puts it into actionable, measurable steps. S stands for specific. Your goal should be clear and well-defined. It should answer the who, what, when, where, and why of your goal. M is for measurable. It should have defined benchmarks to show your progress. A stands for achievable. Make sure your goal is realistic. It should be challenging, but not so far out of reach that you get frustrated and quit. R is for realistic. Make your goal relevant to your values and your long-term plan. And T is time-based. Set a clearly defined timeline to achieve your goals. Then you can reevaluate them and set your next goal. So we're going to take a quick look at how this would apply to a real life goal. So instead of saying, I want to eat better, we're going to make this a SMART goal. So we're going to make the goal specific. I'm going to increase the fruits and vegetables in my diet every day to ensure my body is getting what it needs to function at its best. So we're going to make it measurable. I'm going to eat at least 1 fruit or vegetable at every meal. Is it achievable? Yeah, I can eat 3 servings of produce every day. Is it realistic? Yeah. And studies show that eating more produce helps prevent many chronic conditions, and I really want my body to have what it needs to function at its best. And time-based. I'm going to do this for 6 weeks, and then I'll reevaluate. So you look at, if it was a struggle, we're going to add another 4 weeks to this goal. If it wasn't, well, let's make it 5 servings of produce every day. So how can Humana's workplace wellness solution, Go 365, help you and your employees reach their goals? Well, Go 365 provides motivation and rewards to help you stay on track. You're going to earn points for every healthy habit and preventive health appointment. As you earn points, you're going to increase your status and then earn even more rewards. So in the example, we used eating a healthier diet as a goal. So with Go 365, you can start earning points for keeping a food log. With a change in the diet, you might also lose weight. So then you can earn points for keeping a weight log and for being in a healthy weight range. You will even earn points for the things that you're doing anyway, like going to the dentist or going to get a flu shot. So the rewards of working on your well-being, of course, is your personal health, and you're going to be feeling good and energetic. With Go365, you're also rewarded with bucks to spend in the Go365 mall. Each point you earned by keeping a food log or taking a walk at lunch or after dinner is then converted into a buck that you can spend on gift cards at one of our popular retailers in the Go365 mall. Or you can spend those bucks on a new fitness device, which will provide even more motivation every day to stay active. Each point is then converted into a buck to spend in the mall. Each adult can earn up to $300 per year to spend in that mall. And employers, like Thomas said, they have a potential to earn discounts on their medical premium. So feeling good, saving money, and making your next Amazon purchase with money that you didn't come in your paycheck. Now that is some motivation that you can use. So I recorded this and put it on a brain chart. So if you want to get your phone out and open the camera app, hold it up to the screen, and you can watch this presentation later if you want to, or you can pass it along to your employees or to other members who might be interested in it. So please take a minute to take a screenshot or get your camera open and check out this QR code to be able to get this information later.
Monica, you're awesome. And I'm going to miss having you on this call. I think this is Monica's last time she'll be presenting on behalf of Humana. She's not leaving Humana, but on behalf of Humana on this call, you are terrific. Your professionalism and how you deliver is just fantastic. I encourage you, if you need more information, reach out to Monica, reach out to us at the Chamber. We'll make sure we put you in contact with the right people. Thank you, Monica.
Thanks so much. Thank you,
Monica
Thomas.
and Humana, for your partnership, and I'll see you downstairs.
Sounds good.
Joining us now is our very own Brandon Rudd, the Director of the Center for Research and Data at the Cincinnati Chamber of Commerce. Brandon has been busy. He's recently brought you the inaugural, the highly regarded, and the highly coveted State of the Region report. And I mean that when we go out to events and we go out to meetings and said, hey, do you still have any of those reports that you guys did? They're so informative. And we do. But Brandon, give us a peek at your next venture in research and data. Take it away.
Thanks, Thomas, and thanks everyone for having me here today. I'm going to share my screen with you. The next venture is one that I've been very excited about since I came to the Chamber last year. One of our big goals was to create a regional indicators database. This is something that the Chamber had been looking to do for a while, and something I was very excited to be a part of. Brad Mason in our marketing communications department and I have worked on this diligently over the past, since we completed the State of the Region report. In the State of the Region report, we announced that there was going to be several indicators that we would create a dashboard for so we could track our progress over time. We listed at the end of the State of the Region report several, and we've expanded that now to 33 indicators. What you see on your screen is a sneak peek of what that database is going to look like. It is almost ready to launch. We're going to launch it later this month. Look for a press release and more information in your inbox. But you're getting a sneak peek today, one of the first groups to be able to look at it. When you go to the what will be the Regional Indicators website, you'll see this splash page that will point out to you that there are 33 different performance indicators that we've selected. We have 22 peer regions, including Cincinnati, that we compare ourselves to, and we would like to compare our progress over time. We want this to be a useful tool for all of our members, for our stakeholders, for local policy leaders, so they have a one-stop shop for all of the data about the Cincinnati region. And we know that we're all dealing with the same data. We're dealing with the best available data and the most recently available data. So as you go to the site, you'll be able to scroll down and you'll see that there are several categories of indicators. We hope to add to these over time as we get more feedback from our members. These initial indicators are ones that we heard repeatedly were information that members and stakeholders would like to have. If you continue to scroll, you'll see that there's about the Center for Research and Data section and also links to other reports that we have produced, and we'll continue to add to that as well. But if you click into one of the indicators, for example, economic indicators, you'll be directed to the screen for that particular set of indicators. And you'll see up here on the right, we have each of our indicators as well as the Cincinnati region's rank in those indicators. And so, for example, in regional real GDP, among the 22 regions that we've selected, we are 11th out of 22, so right in the middle of the pack there. If you scroll down, you'll see the data for each of these indicators. For example, in regional real GDP, you'll get an explanation of what that is, what our rank is, and what our total is. Here in this case is 141.6 billion, which you can see our peer regions here range in size from very large regions like Dallas and Houston to smaller local regions in our direct geographic vicinity like Dayton and Lexington. We fall in the middle of the pack here for GDP. And what you'll be able to do is you'll be able to click download the image over here. And when you click download the image, you'll get your very own version of this chart, which you can then use in your publications with attribution to the Center for Research and Data. There are several other indicators and ways that we are displaying that data, but you'll see that each one of them have a peer rank listed. And in the future, we are going to use this space in the bottom left corner of each of the indicators to show how we have how our ranking in that particular indicator has changed over time. For example, for Fortune 500 companies, we now know that GE Aerospace is going to be locating their headquarters here in Cincinnati. Our number of Fortune 500 companies will grow to 8 in the coming year, and we'll see how that changes our ranking among our peers. If you click in the upper right-hand corner, you'll have a quick access menu to all of the other data indicators, and you can click on one of the others, for example, DEI indicators, diversity, equity, and inclusion, and you'll see that data as well. In this one, I want to point out that we have some different ways of showing that data. For example, racial income gap here, you can see both the Black household income and the non-Hispanic white household income displayed on the same graph. So this is a really exciting thing for us here at the Chamber. We're going to be rolling it out in the coming weeks, so stay tuned for that. You'll be able to click into the website and view all the data for yourself. And this is something that's going to continue to grow with more data indicators and more peer regions to compare ourselves to. It's really exciting. I cannot stress how enthusiastic I am about this project. And so hopefully it'll be useful to all of you. And thank you for having me today to show you a sneak preview.
Brandon, thank you for all you do to support the businesses in the region. And I just want to say, Brandon, and he talked about Brad Mason, well done. Proud to be your guys' colleague. This is just exceptional work, you guys. Well done. Thank you.
Thank you.
So more on that coming. It's so impressive what they've put together. So thank you, everybody. I do want to share a couple upcoming events that are coming up. February 9th, we have our third session of Diversity in STEM, Girls in STEM in the Educational Corridor. It's an unbelievable panel of speakers we're going to have at an Ensemble Health Partners from 8:30 to 10. I really encourage you, if you've been there, you know the great quality of information. If you haven't been there, I encourage you to attend. This is very cutting edge, dynamite stuff in conjunction with the Gaskins Foundation, the African American Chamber, the Hispanic Chamber, and the Apprentice Cincinnati and the Cincinnati Chamber. We also have our next installation of Cincy Blend, Coffees and Connections at Bromwell's Hearth Room on February 15th. at 8:15, and Membership Benefits 101, February 23rd. Learn how to find out more about the benefits that are available to your business, and that'll be in person at Shakely. You can find out all about the upcoming events on our website, or you also have the QR code right there in the corner. Second to last, Brendan talked briefly, the annual dinner, March 2nd, Duke Energy, honoring the great living Cincinnatians. If you've been, you know how impactful and powerful that night is. If you haven't been, I'm not trying to sell you. I encourage you, take the chance on going, because I know you're going to love it. And I know it's something that you're going to want to have part of your annual calendar. We look forward to seeing you all there. And lastly, I think there's one more slide. March 2nd, 2023. I can't believe it's March. We have an unbelievable opportunity with our keynote speaker. It's Chief of Police, Teresa Thigi. She's agreed to be our